Hello and welcome everyone. This is the pre-application technical assistance webinar for the National Coordinating Center, or NCC, for AHRQ's Healthcare Extension Service state-based solutions to healthcare improvements. We've got some Zoom information here in case you're having any technical difficulties. We've got the links here, but if you are having problems, please see at the bottom the highlighted email where you can send an email to arc_hes@arc.hhs.gov if you're having connection problems. We've got a few housekeeping reminders. This presentation is being recorded. The presentation slides and recording and FAQs will be posted in about 1 week in these locations. Any NCC NOFO inquiries can be sent to that same address, AHRQ_HES@ahrq.hhs.gov. And we want to let you know that technical questions in the chat box will not be answered during this webinar and should be submitted via email to that address. If we've received any FAQ, any questions that we haven't answered separately for you yet, you will still receive an answer either during this webinar or by separate email. Here's our agenda for the day. We're going to go quickly through some staff contact information. We'll talk about the Notice of Funding Opportunity, or the NOFO, in some depth, and we'll do some FAQs at the end and then do some final comments or reminders. The presenters today are my colleague Jan Delamar and myself, Jenny Schneer, and we are both with the Center for Evidence and Practice Improvement. Jan and I have both been at AHRQ for over 20 years and have worked on numerous initiatives. And we're very glad to be sharing the highlights of this NOFO with you and appreciate you taking the time to attend this webinar. If you want to reach us, here are our contact information. But if you're not sure who to reach out to, go ahead and send an email to the arc@HES address and we'll make sure it gets to the right person. Okay, let's get into the NOFO itself. Please remember that our presentation is a general summary of the information in the NOFO, and applicants must refer to the RFA itself for exact details. Now we'll focus on this funding's purpose and objectives. The purpose of this NOFO is to invite applications for a National Coordinating Center, which I'll be calling the NCC during this presentation, to provide support and guidance to AHRQ's Healthcare Extension Service, which I will either refer to as HES or I'll refer to the cooperatives as co-ops. The NOFO is a U54 Cooperative Agreement. The NCC will provide a wide range of services in 4 main areas: technical assistance, learning networks, communications and dissemination, leadership, and project management. For context, AHRQ is developing a healthcare extension service which consists of 3 related NOFOs: this National Coordinating Center, a healthcare extension cooperatives or cooperatives, and a National Evaluation Center. We want to emphasize the connection of the NCC NOFO to these other 2 health extension service NOFOs and strongly encourage applicants to review the other 2 NOFOs to prepare an application for the NCC NOFO. Information on all 3 initiatives are available online. The overarching objective of the NCC is to support the cooperatives and contribute to the overall goal to accelerate dissemination and implementation of patient-centered outcomes research evidence into healthcare delivery through improvements in healthcare policy, payment, and practice, and to reduce healthcare disparities, especially among people who receive Medicaid, are uninsured, and other people who are medically underserved. Here we want to point out some of the important timelines. The NOFO was posted on September 26th, and a letter of intent is due 30 days prior to the application due date. I do want to mention that the letter of intent is not required, is not binding, and does not enter into the review of a subsequent application, but the information allows AHRQ staff to estimate the potential review workload and plan for the review. Following the application due date, applications will undergo a compliance check. A special emphasis panel will then be created and held to review your application. We estimate that the review will be approximately 4 months after the receipt date, and an award will be made approximately 4 months after that, but we don't have an exact date at this time. Ultimately, AHRQ leadership makes the final determination of who receives awards. As a reminder, this is a one-time call for applications. I also want to urge you to check back frequently at the websites we've listed. If there are any changes to the due date or any other NOFO information, you will find a notice here and on the NIH notice of change up to funding opportunity. Once again, I want to emphasize that for this project, we're using a cooperative agreement. This is a grant mechanism, which is a financial assistance mechanism that is used when there will be substantial federal scientific or programmatic involvement. Substantial involvement means that after award, AHRQ scientific or programmatic staff will assist, guide, coordinate, or participate in project activities. You can see section 6.2 for additional information about the substantial involvement for this NOFO. The total funds available for this NOFO are $14,250,000 for the entire project. One award is anticipated. The total costs, both direct and indirect, for a project awarded under this NOFO will not exceed $3,350,000 in any given year. Applicants may propose different annual budgets for each year of the project, as long as any one year does not exceed the 3.35 limit, and the entire project does not exceed the 14.25 limit, and the entire project does not exceed 5 years. Next, we're going to talk about the main areas of the NCC NOFO, followed by the required application research strategy elements, and then the required performance measures. Here's an overview of the NOFO requirements. The central role of the NCC will be to provide the cooperatives with a wide range of support, resources, and collaborative guidance, and to convene the cooperatives to facilitate mutual learning in real time. The NCC will also fill a key role as a liaison among the cooperatives and the NEC to facilitate coordination and communications. We will now review the key NOFO requirements, and I'd like to note that these requirements will show up again when we go over the elements of the review process. This NOFO has what is known as must requirements. Applicants must clearly address the following items in their applications. We're going to talk now about the high-level requirements for the NCC NOFO. Again, be sure to work from the NOFO itself because this slide set is an abbreviated version of the full text from the NOFO requirements section. Under technical assistance, or TA, there are 6 must requirements. Applicants must clearly address the following items in their applications. Under technical assistance to the cooperatives, the NCC must assess each cooperative's needs and preferences for technical assistance content and mode of delivery on an ongoing basis. They must identify and disseminate available evidence-based tools and resources to share with all cooperatives. And they must provide or identify subject matter expertise or resources needed to contribute to cooperatives' initiatives. In addition, the NCC must provide TA to the cooperatives on the topics shown here. Next up are the learning networks, which have 10 must requirements. Applicants must clearly address the following items in their application. For example, under learning networks, the NCC must organize, convene, and facilitate learning networks to bring together representatives from each cooperative to learn from each other and external experts. In addition, they must establish a learning network that includes all cooperatives. The learning networks must also convene a federal interagency workgroup of participants with knowledge of relevant state-based quality improvement work and identify subject matter experts from across the cooperatives, the NEC, or external experts to lead learning network discussions and presentations. In addition, the NCC must also create a process for collecting and synthesizing feedback from TA activities to share implementation progress and adaptations with the cooperatives in real time. They must also plan and implement an annual HES 2-day in-person meeting at AHRQ or other federal buildings in the Washington, D.C. area. Next, we'll look at the communications and dissemination requirements. There are 5 must requirements. Applicants must clearly address the following items in their application. For example, under communications and dissemination, the NCC must create and implement an evidence-based communications and dissemination plan to promote cooperatives' work and develop dissemination materials. They must prepare tools and resources like implementation strategies or protocols for identifying P-Core evidence based on the best practices from individual cooperatives for posting on AHRQ's website. Under communications and disseminations, the NCC must also promote collaboration and support communication among HES participants, including the cooperatives, NEC, and AHRQ staff. They must develop, maintain, and manage a web-based platform for intra-team communications and document sharing. Here we're looking at the leadership and project management area, which has 7 must requirements. Applicants must clearly address the following items in their application. Under leadership and project management, the NCC must lead and manage all activities of the NCC and maintain documentation of all activities, including preparing quarterly progress reports, meeting at least monthly with the AHRQ program officials. They must also serve as a liaison between AHRQ, the cooperatives, and the NEC, ensuring cooperation, collaboration, and participation in developing learning networks. They must also lead outreach to the cooperatives to participate in technical assistance activities, working groups, and meetings. In addition, the NCC must engage with national and state partners and professional and community-based organizations invested in patient-centered healthcare delivery. They must conduct periodic site visits to each cooperative over the course of the grant period to build and nurture relationships, observe real-time barriers and facilitators, and foster strong working relationships. They must also cooperate and collaborate with the NEC to participate in a process and effectiveness evaluation of NCC services and activities. Okay, I'm going to take a quick break with a reminder in case you joined along the way. This presentation is being recorded. The presentation slides and recordings and the FAQs will be posted in about 1 week at these locations. NCC NOFO inquiries should be sent to the email box ahrq_hes@ahrq.hhs.gov. And technical questions in the chat box will not be answered during this webinar and should be submitted via email. Excuse me a second. Okay, now we're going to talk about, move on to the required application research strategy elements. This section's text has also been edited for this presentation, and you should refer to the NOFO for the full description of these elements. The NCC Cooperative Agreement is a multi-component NOFO, which has, in this case, 2 required parts known as components. There's an overall component and a supporting healthcare extension cooperatives core, which is abbreviated in the form as Support HC EXT Co-ops. Each of these 2 components have their own requirements and research strategy that need to be addressed in your application. Each have review criteria and each have their own page limits. There is a limit of 12 pages for the overall component and a limit of 12 pages for the Support Healthcare Extension Cooperatives core. There are specific instructions for multi-component applications. Please be sure to carefully read and follow the NOFO instructions for guidance on this type of application. We start with the overall component. Applications must describe the overall focus of the NCC proposed activities, how the activities like technical assistance, learning networks, communications, and leadership contribute individually and collectively to achieve the goals of this NOFO. The applicant's experience and capacity to engage in the proposed work, including connections with key subject matter expert individuals and organizations. For the overall component research plan, applicants should describe the aims of the proposed National Coordinating Center. Be sure to summarize the expected outcomes of the NCC as a whole, including the impact that the results of the proposed NCC will have on the HES. Briefly describe how the NCC is structured and how the activities fit into the overall goals. For the overall component research strategy, applicants should summarize the structure and overall strategy of the NCC and approach to establishing and managing relationships with and support services for the cooperatives and the NEC. This includes descriptions of the items shown on this and the following slide. This component requires that you submit letters of support from partner organizations and entities and specify the nature of collaboration and their role in the NCC. Submit these letters only in the overall component. Information is provided in the NOFO with specific guidance on what should be included in the letters of support. Applicants must describe the proposed approach and associated evidence-based strategies or best practices for developing technical assistance program, convening learning networks, providing communications and dissemination support, and leadership and project management. Applicants must describe approaches and strategies based on the most current evidence available in the field. Applicants must describe how they will advance health equity as it relates to their work supporting the cooperatives. Okay, 1 second, I'm off of my notes for a minute here. Give me a moment. For the technical assistance approach, describe specific activities, strategies, and formats that will be used to provide TA on topics related to implementing, monitoring, and improving extension services, creating and convening a multi-stakeholder council, identifying patient-centered outcomes research and other relevant evidence, tools, and resources, discuss potential challenges, barriers, and solutions to providing TA to multiple cooperatives, and discuss how the cooperative's TA needs will be assessed and provided. Describe subject matter expertise, the overall approach for establishing guidelines, and about types and volumes of TA. Describe how information from AHRQ project officers and cooperatives will be used to provide brief descriptive reports, and how PCOR and other relevant evidence, tools, and resources will be identified and disseminated across the cooperatives. Applications should also describe your approach for the learning network for items you see here and on the next slide, such as how subject matter experts will be identified and engaged to lead learning network discussions and presentations, and to describe the approach for assessing cooperatives' needs and preferences for learning network content and activities. We'll also need to describe the process for providing systematic rapid cycle feedback to the cooperatives generated from TA and input from healthcare extension agents and stakeholders. Also discuss how participants will be identified for the Federal Interagency Workgroup. Applicants should also describe your evidence-based communications and dissemination approach for creating a communications and dissemination plan to promote cooperatives' work through diverse channels to multiple audiences. You should describe the process for identifying and designing content to be developed for AHRQ's website and include examples of types of content and intended audiences. Also describe the approach for preparing tools and resources that support the cooperative's work for posting on AHRQ's website and tools for change. Describe a plan for supporting communications across the entire project's participants that include maintaining a web portal for document sharing. Applicants should also describe your approach for leadership and project management, including your experience serving as the lead in the national coordinating or support network capacity, providing guidance, TA, and subject matter expertise. Describe the approach for coordinating activities and the plan for ensuring collaboration and participation, along with the other items you see on this slide. Okay, at this point, give us a second. I'm going to switch over to my colleague, Jan, who's going to pick up this section of the presentation.
Thanks, Jenny. I'll now cover the review criteria for all applications. There are two areas that are important in the review process. The first is administrative criteria. Upon receipt, applications will be evaluated for completeness and responsiveness. Incomplete or non-responsive applications, or applications not following instructions given in this NOFO, will not be reviewed. There's also the merit review criteria, and this is the scored section that I'll discuss in a moment. We also want to note that all applications for this funding announcement will go to a special emphasis panel for review. The Special Emphasis Panel, or SEP as we refer to it, is an ad hoc group of experts in fields related to this funding announcement. The SEP composition and review date are pending. There will be a notice in the Federal Register once the review date has been established. In the overall component, reviewers will provide an overall impact score to reflect their assessment of the likelihood for the center to exert a sustained, powerful influence on the research fields involved in consideration of the following review criteria and additional review criteria. The scored review criteria include the following categories: significance, investigators, innovation, approach, and environment. Reviewers will consider each of the 5 categories and give a separate score for each. Please note that an application does not need to be strong in all categories to be judged likely to have major scientific impact. So, for example, a center that by its nature is not innovative may be essential to advance the field. As you'll see here and in the next few slides, the table in purple includes the standard review criteria for each of the 5 categories. So here you can see our standard criteria for significance. Criteria on this slide are specific to the NCC NOFO and link back to the must requirements that Jenny spoke about earlier. They include, will successful implementation of the proposed NCC support new sustainable capacity to increase the D&I of PCOR evidence and evidence-based healthcare delivery improvements among the cooperatives? And will successful implementation of the 4 main areas of the NCC advance healthcare equity? These items are standard criteria for the investigators category. And these are the unique criteria that link back to the must requirements, including are key personnel roles and associated activities clearly described? Also, is the PD or PI devoting at least 25% minimum full-time effort in each given year of the project? Or if there are multiple PDs or PIs, is each devoting at least 10% full-time effort? And to what extent do the proposed key personnel have relevant experience and expertise across the 4 primary NCC activities? Also, to what extent do key personnel collectively have current or previous experience serving as leads in a national coordinating center or a support network? To what extent do key personnel collectively have experience engaging with national and state partners and professional and community-based organizations invested in delivery of patient-centered healthcare delivery improvements? These are the standard review criteria in the category of innovation. There are no unique NCC criteria under innovation. Here are the standard review criteria in the category of approach. The unique criteria in the category of approach include, to what extent does the overall approach demonstrate a clear understanding of the challenges to supporting cooperatives with varying skills, experiences, and resources? How effective is the approach for developing and delivering TA to the cooperatives? And to what extent will the approach for convening and facilitating learning networks result in building meaningful relationships, peer-to-peer learning, and problem-solving among cooperative participants? Also, is the approach for communicating and disseminating information to promote the cooperative's work evidence-based? And how well does it describe multiple audiences for this work? Based on the proposed leadership and management plan, how likely is it that this applicant will be an effective leader of the NCC? Here you can see the standard criteria for the category of environment. And this is unique to the NCC and links back to the must statement. To what extent do letters of support from collaborating organizations and individuals indicate substantial engagement and document specific contributions of the partner during the proposed collaboration? There are two unique criteria for supporting the cooperatives. These are, does the approach for supporting the cooperatives clearly describe strategies and activities to accomplish the goals and objectives of the NCC? And does the approach for supporting the cooperatives fulfill the requirement to cooperate and collaborate with the cooperatives and the National Evaluation Center? Reviewers will also consider the items on this slide in providing an overall impact score, but they will not give separate scores for these items. And as applicable for each proposed project, reviewers will consider each of these, but will not give scores for them and should not consider them in providing an overall impact score. The following will be considered in making funding decisions: scientific and technical merit of the proposed project as determined by scientific peer review, availability of funds, responsiveness to goals and objectives of the NOFO, and relevance and fit within AHRQ research priorities, as well as overall programmatic and geographic balance of the proposed project to program priorities. Moving on to performance measures, there are required performance measures for this project that cut across 3 domains. They include reach measures, you can see those here. Also, process and impact measures. The award recipient should have a plan for capturing these types of information. And with that, I'm going to pass it back to Jenny to go over frequently asked questions.
Just going to check our audio is working well now. Okay. Thanks, Jan. We're going to turn to frequently asked questions, and I will note that we have received a few questions that we have not yet replied to, so you may not see their answer here, but everybody will get a response, and we will also accept questions going forward, so it does not have to arrive by this date in order for us to respond. So do continue to send them in, and if we receive questions, we will have an FAQ document that we're going to put up on our technical assistance page in about a week. And if we see questions that appear to be relevant to the larger applicant pool, we will add those as time goes on. We'll continue to add questions and answers to those items. Okay, question 1. Can an organization apply for more than one NOFO comprising the HES? Yes. Organizations are eligible to apply to all NOFOs related to the healthcare extension service, either as a prime applicant or as a subcontractor, as long as they meet individual NOFO requirements. If submitting an application for the National Evaluation Center, the applicant must ensure that the proposed investigative team has no overlap regarding investigators and direct cost funding with any state cooperative or NCC application. Number 2, letters of support. Are letters of support required from all senior key personnel and other significant contributors? You should provide letters of support from partner organizations and entities, letters from individuals who will serve as consultants or collaborators on the project, but with no specified levels of effort should also be included. Do not include letters from individuals who will be supported by the grant who are named in the application. Do not include letters from individuals or organizations that are not directly contributing to the project. And this is specified in the NOFO itself. What needs to be included in the required letters of support? The letters of support should specify the nature of the collaboration and their role in the NCC. Applications must include letters of support from an institutional official that endorses the proposed NCC and describes the available institutional resources that will support the activities of the NCC. Letters should include, in part, a description of the planned activities, duration of the partnership, and any in-kind support. A few questions on budgeting. Are there any facility costs to the NCC to use AHRQ office space for the in-person meeting at AHRQ? No. Are there any travel or lodging costs to the NCC for cooperative members to attend the in-person meeting at AHRQ? No. Travel and lodging costs are the responsibility of the cooperative grantees. Are there any travel or lodging costs to the NCC to attend the annual meeting? Yes. Applicants must budget for at least 2 key personnel to travel to the Washington, D.C. area once a year to meet with AHRQ staff and any invited guests for a 2-day meeting. This set is on NCC's role with respect to the other entities. What is NCC's role with respect to the cooperative's multi-stakeholder council? The NCC is responsible for providing technical assistance to the cooperatives on creating and running the multi-stakeholder council. Question 8. What is the NCC's role with respect to harmonizing data and measurement for the cooperatives and the NEC? The NCC's role is to convene a work group to facilitate discussion of harmonizing data and measurement across the cooperatives. The NEC will provide subject matter expertise for these work groups. Our last question, what part of NCC will be evaluated by the NEC? The National Evaluation Center will conduct a process and effectiveness evaluation of NCC services and activities, including but not limited to technical assistance services and convening functions. Once more, as we're wrapping up on the reminders, yes, the slides and the recordings and the FAQ will be posted in about 1 week. If we've any new questions have arisen as part of this webinar or as you continue to work on the application, please send those inquiries to us. If you asked a technical question in the chat box, it will not be answered. You do need to submit it to the email above. A few final comments just to highlight a few important things. Important due dates. The letter of intent, although not required, should you submit it, is due 30 days prior to the application due date. The application due date is November 25th, 2024. And again, I want to encourage you to keep your eye on any notices in case there's any change to that due date. If you have questions that you may email them to us. For scientific and research questions, address them to arc@hes@arc.hhs.gov. Maybe you've got that memorized by now. If you have peer review questions, here's the email for that. And for financial grants and management questions. Again, if it gets misdirected, we'll make sure it goes to the right place. I also want to remind you that we did a summary of our NOFO in this presentation, so you must refer to the NOFO as the final source of guidance. Here we're providing you with the Health Extension Service website we have on AHRQ's website. I've included the grants announcements for the other 2 companion NOFOs to make it easier for you to locate them. And while we're at it, we want to encourage you to stay connected on AHRQ developments. For the AHRQ News Now, where you would be receiving notices of any updates on this or any new information, as well as the opportunity to sign up for a subscription to various Gov delivery bulletins, like we have one on funding opportunities, we have a specific one for the AHRQ HES, and the newsletter, which I've just told you about. We are on multiple social media spaces, and a little pitch for ourselves, a way to find out about careers at AHRQ. Here's some application resources that AHRQ makes available. Here, I just want to emphasize the importance, if you are new to this process, of registering to apply. Applicant organizations must complete and maintain registrations as described in the How to Apply application guide to be eligible to apply or to receive an award. All registrations must be completed prior to the application being submitted, and registration can take 6 weeks or more. 6 weeks or more, I'm going to repeat that. So applicants should begin the registration process as soon as possible. Even the renewal process may require as much time as the initial registration. And the registrations include the System for Award Management, SAM, the ERA Commons, and grants.gov. And the links are provided here, and there's also information in the NOFO itself. And with that, we're concluding our webinar. We thank you so much for taking the time to participate, and we're looking forward to reading your applications. Thank you.